My name is Sierra Carter, and this is my 7.2 Special Populations Project, and I did diabetes. Description of diabetes. Diabetes is a chronic health condition that affects how your body turns food into energy. Normally, our body breaks down food and turns it into sugar, which is then released into our bloodstream. After it's released into our bloodstream, our blood sugar normally goes up. When this happens, the pancreas is signaled and it releases insulin, which will then take the sugar and insulin and create energy out of it. But with diabetes, our body does not make enough, or cannot use the insulin that we produce. When this happens, too much sugar stays in our bloodstream and our body immunizes itself to our own insulin, causing us to be insulin resistant or not using it in general. When there is too much sugar in our bloodstream, we cannot produce insulin to counteract and make energy out of it later on in life. This can cause health problems like vision loss, many heart disease, and kidney disease. Prevalence of diabetes in the U.S. We all know that diabetes is a very common disease in the United States, as 37.3 million people have diabetes, and every 1 in 5 people do not know that they have it. 11.3% of the population has it, and 96 million adults have prediabetes. Diabetes can be seen in all age groups. You can be born with it, or you can get the disease later on in life. People that are most affected. Racially, American Indians or Native Americans are the highest race, with 14.5% that are affected by it. The income level of less than 100% FPL, with 14.4% have it. And education-wise, 13.4% of people who did not complete high school have diabetes. What is the main causes of diabetes? There aren't just one main cause of diabetes, because there are many different types of diabetes. There's prediabetes, gestational diabetes, type 1, and type 2. The difference between these are prediabetes is before you actually have the disease. Gestational is when you can get diabetes during your pregnancy and it'll be gone after pregnancy. And then type 1 and type 2 are the main diabetes that we see daily. They all have different forms of treatment and can have different signs as well as symptoms. The main causes below are for type 1 and type 2. You can get these by your genes, being a genetic factor, environmental factors, lifestyle factors. You can get diabetes by being overweight or obese, and having lots of gum, skin, and vaginal infections can be a main cause of diabetes as well. Pathophysiology and what organs are affected by it. In type 1, pathophysiology happens when the body immune system destroys pancreatic beta cells, which are the only cells that make hormone insulin, which regulates our blood sugar. So you can see type 1 diabetics are insufficient to insulin. So the glucose will go into the pancreatic cells, but then our cells will not be able to digest the sugars and turn it into insulin, making the insulin not working. For type 2 pathophysiology, this is the most common form of diabetes. It can be caused by genetic or environmental elements that affect the beta cell function and tissue insulin sensitivity. The body does not produce enough, or the cells ignore the insulin, creating an insulin resistance. And it's the same thing as type 1 on a certain level, but instead of not taking the insulin is just resistant. So we do produce it, but because of the effects of it, we do not take it in, causing the resistance of not creating and ignoring the insulin. Diabetes can affect many organs of the body, like the heart, blood vessels, nerves, eyes, kidneys, and the skin. It can affect how we sleep, our hearing, memory, and healing systems of the body, meaning that you can sleep way worse with diabetes. Your hearing can be gone. It can cause memory loss and skin infections. Also, if your blood sugar is too high, it can cause for kidney stones and heart diseases later on in life. It can affect our vision loss, and our healing system of the body, meaning that the way our body heals, the wounds and infections can be caused and affected by diabetes. Major signs and symptoms. The first two are you are very thirsty and you urinate often. This is not normal, as people can be very thirsty and can urinate depending on different life and environmental factors. This would be a next level thing. Next would be losing weight without trying to, or not knowing the presence of ketones in your urine. Ketones is a type of protein that is in our urine, and there should not be many in your urine unless you have not eaten protein for that day. So for instance, if a woman were to take a pregnancy test and she did not have diabetes and she did not eat that morning, she might have ketones in her urine because it is built up for not having any protein in the body. Whereas with diabetes, it doesn't matter if you've eaten protein or not, there are ketones in the urine. The next two are feeling tired and weak and very irritable and having mood changes. And then the last two are having blurry vision and lots of skin, gum, and vaginal infections. Medical treatment and management. As there are many different types of treatment and many different types of diabetes, there are many different types of ways to manage diabetes naturally. Some ways naturally are having a better lifestyle. This could be eating healthy foods, losing excess weight, or becoming more physically active in your daily routine. But medically, you could take an oral pill of metformin and many other oral drugs and making sure your blood gets checked monthly. You can also take insulin as needed or use a Dexcom as well, which is what we see a lot on a daily basis, where people may test their blood with the needle, and then if it's high or low, they may take insulin or may produce insulin or not. Also, Dexcoms can be attached to any body part where fat is at. That way, you can get into the bloodstream faster. Benefits of exercising with diabetes. Exercise helps control your weight, lower blood sugar or blood pressure, lower harmful LDL cholesterol and triglycerides. It'll also raise healthy HDL cholesterol, strengthen muscles and bones, reduce anxiety, and improve your general well-being. There are many different benefits of exercising with diabetes. Exercising can lower your blood glucose levels and boost your body's sensitivity to insulin, countering your insulin resistance. Exercising in general will be a great way to reduce your diabetes and signs and symptoms that you may incur in your daily life. But some main exercises that you can do are aerobic resistance, or doing both combined training of aerobic and anaerobic resistance as well. They're equally good at lowering your HbA1c values, which is one of the main effects and main cells that is used with diabetes. Resistance training and aerobic exercises both help lower insulin resistance in previously sedentary older adults with abdominal obesity at risk for diabetes. Basically, this means that resistance training helps those who may have a sedentary lifestyle and who may be overweight or obese, because it'll lower their insulin resistance, causing the risk of diabetes if they do not have it to be lower. Combining the two types of exercises proved more beneficial than doing one or more alone, as a study that I read from the CDC. Their Fit VP. Diabetics should perform moderate intensity exercise for 3 to 4 days per week with a total of 150 minutes per week, or they may see their doctor to increase or decrease when needed exercise. For improving cardiorespiratory endurance, a diabetic could do a brisk walk or vigorous walk for 30 minutes 3 days a week. At moderate intensity, they could run on a treadmill or outside for 20 minutes 2 days a week. Lastly, a high-intensity interval training, or HIIT, could be done 1 day a week. These exercises could help decrease fasting blood sugar for a type 2 diabetic. For aiding in muscular fitness, a diabetic could do deadlifts 3 sets by 6 reps, bicep curls 4 sets by 8, and lastly, medicine ball wood chop 2 sets by 10. All weight training should be done twice a week on easier exercise days at moderate intensity of the weight. I say this because it might be harder for their body to accumulate after doing a hard workout and then lifting and doing weight training. Strength training can help improve glucose control and reduce the risk of cardiovascular disease, as it can stabilize your blood sugar, which we all know at this point that diabetes can affect cardiovascular diseases and can affect your heart down later on in life. Lastly, for flexibility exercises, a diabetic could do a rolling neck stretch, which you would roll your neck back and forth slowly 10 times clockwise and counterclockwise for 2 sets. Next, they could grab their hand or their arm around their back and try and get them to connect, causing a stretch in the biceps and in the shoulder for 15 seconds for each arm. Lastly, calf wall stretch, holding for 30 seconds each leg. This is where you will place your toes at an angle on a wall and go closer or further depending on if you can feel the stretch or not in your calves. These stretches can help a diabetic as they are static and can help with the flexibility of joints out of a stiff movement. All of these exercises and more should be seen and should be approved as from their doctor, as exercising can have a negative effect on diabetics, but a more beneficial effect as well. With that being said, there are some special considerations when exercising with diabetics. Like I said before, exercising can have a negative effect, and it is really important to get approved of your fit BP by a physiologist or your doctor. If your blood glucose is too low or below 100 milligrams, it is important to ingest food like juice or sugar or glucose tablets to get it at a pretty normal level. Logging your blood sugar before, during, and after exercise is a great way to understand how your body is implementing the exercise in your blood sugar as you're exercising. Maintaining a high level of fluids before and after exercise is important, even if you don't have diabetes. And then, of course, testing for urine for ketones, or if the blood sugar is too high, if the blood sugar is too high, act safely and maybe consider not exercising. Why do these matter? These matter because it is important to understand and consider these matters because it can negatively or positively impact your health during or after exercise. It is always best to ask your primary doctor what you can and cannot do. If blood sugar levels were too high, then the targeted level while getting active and taking in exercise can make the levels even higher, which can cause complications in your health. Also, the type of activity you can do can possibly change your outcome of treatment while having diabetes. In conclusion, diabetes is a chronic health condition that affects how your body turns food into energy. We know that it affects our blood sugar and how it raises and lowers. There are two types, type 1 and type 2, but we cannot forget about pre-diabetics and gestational diabetics. It is most common that Americans have it without even knowing that they don't have it. It can lead to cardiovascular disease, heart disease, kidney disease, skin disease, and other health complications, and there is no cure, meaning that they will have this for the rest of their life, but there are ways to prevent having low or high blood sugar. Exercise can improve and help regulate it. It is important to also know that having diabetes does not stop you from living. It will not make you sit in your room, not doing anything. That is a chosen thing that you will have to choose if you do not want to do anything with your life because you're diabetic. Many athletes have diabetes. Many everyday Americans have diabetes. Moms, dad, no matter the gender, race, or ethnicity. Diabetes does not stop from going into the body, but it will also not stop you from living. Many medications and treatments can help with this, as I talked earlier about the Dexcom, insulin, blood sugars, and more. And then these are my references.